You have like sa bone remodeling. Remember, we remodel our bones by destroying it and then making new ones. That's what we are doing with the bone remodeling. So, ulitin ko lang konti. If we are going to break down our bones, we call that bone resorption. And the one responsible for the breakdown is the osteoclast. And on the other hand, when we are going to synthesize or make new bones, we call that the process of ossification or osteogenesis. And the cells responsible for the building up is called the osteoblast. Okay? So when we make new bones, class, we are depositing substances there, minerals. So what are those? We need the calcium and at the same time, the phosphate. Okay? That's the minerals that we need for our bones. Okay? Para magkakaroon, class, ng normal na bone density, hindi siya madaling masira. So our body actually maintains homeostasis between the calcium and the phosphate levels, especially the levels in the blood and also the bones. Because I have said this last time, both the calcium and the phosphate also have different activities in the body. So they are not just found in our bones, but we need them also for the other cellular activities. So just like the calcium, we need that for muscular contraction. We need that for the release or the production of our neurotransmitters like norepinephrine and acetylcholine. We need that for the action potential so that our heart beats and at the same time our brain will function kasi we also have action potential in our brain. So our body, class, see to it that there is a normal level of both these substances in the serum so that we can use that to other activities and at the same time normal levels needed for the ossification process. That's the making of new bones. You have to remember that kasi if there will be an imbalance between the levels of the serum, calcium, and phosphate, there will be a problem, class, in the bone remodeling. And in that case, pwedeng mas mataas na yung bone resorption kaysa sa ossification. What does it mean? Mas marami na yung nagbe-breakdown na bones kaysa sa na-form na bago. And that will lead to a lot of conditions like osteoporosis. Sa osteoporosis, there is a progressive bone loss. So, ang mangyayari niyan, makukulangan na ng minerals na nandyan sa bones natin, bababa yung bone density, and then the bone will be fragile, madali siyang sample ma-fracture. Okay? So, sa osteoporosis, there will be an imbalance sa calcium. Pwedeng kulang yung serum calcium mo, so wala ka nang magagamit sa other cellular activities. Therefore, the body will look for another source. And remember, we have a lot of calcium in the bone, so that will be a good source of calcium for the serum. So talagang sisirain yan ng body yung calcium natin sa bones and then ibabalik sa dugo para may magamit tayo. Now remember, our biggest bone in the body is our vertebral column. So kaya siya yan yung parang pinaka nakikita natin sa someone with osteoporosis. Nagabako sila kasi their bones there are being destroyed and the calciums deposited in that part are being released back to the serum. Okay, I hope you understood that one. Kulangan na sila ng bone mass and we have a lot of risk factors for that. So si Paget disease, which is also known as ostitis deformans, we have new bones that are formed faster than the normal process, and that there will be misshaping of the bones after. The bones may be enlarged and at the same time, iba yung kanyang shape. That's for the Paget's disease. Okay, so we have limited bones that will be misformed here. That will be a problem also with the ossification process, yung pag-synthesize ng new ones. Sa osteomalacia, that is also again because of the problem in the ossification process, and that is because of the vitamin D deficiency. Okay? So paano ba natin na-form yung vitamin D in the body? Tayo mismo nagfo-form tayo, nagre-release tayo ng vitamin D sa body natin. How do we do that? Vitamin D is mostly produced in the skin with the help of the ultraviolet rays or the ultraviolet radiation from the sun. So hindi pwedeng hindi tayo magkita class ng sunlight. Kasi paano tayo magpuproduce ng vitamin D kung hindi tayo naarawan? Now, si vitamin D is very crucial in the absorption of calcium. Like in the food that we eat, pag kumakain tayo and the food that we eat contains calcium, without vitamin D class, we will have difficulty in absorbing that calcium. Okay, yan kasi yung trabaho ng ating vitamin D. Pinapataas yung calcium and actually both calcium and phosphate, pinapataas ni vitamin D yan sa body through increasing the absorption. Okay? It's not just with the food that we eat. Yung calcium natin na nasa body na, example nasa blood na, syempre the blood will go to the kidneys and there will be filtration process. Now, si calcium may be incorporated in the urine for excretion. Pag meron kang vitamin D, pinapataas din yan yung reabsorption ng calcium. What does it mean? Supposedly, iihi mo na yung calcium mo, pero anong gagawin sa kidneys? Because of the action of the vitamin D, mare-reabsorb yung calcium. Mababalik siya sa body, specifically in the blood, so that you can use that again for different cellular functions. Okay? Or you may use that again in the osteogenesis na process. Pwede siyang ma-deposit again in the bones for proper bone mineralization. Okay? That's the work of the vitamin D. So without vitamin D, we may have conditions. We have this one called osteomalacia, or kung sa bata, we call that rickets. Okay? So this is osteomalacia class. Ayan. So there will be also deformation of the bones, just like the Paget's disease, na mag-iiba yung formation. Instead na mag-straight imuhang bones, malahi na ang iyahang formation. So just like this one, the vargus and the valgus. These are actually common sa children. Pero pwede din naman yan siya sa adults. Okay? So, do you have questions before we'll move on to the treatment of our osteoporosis? Kasi ito yung pinaka-common. Questions muna, baka meron kayong part doon na hindi naintindihan. Wala? So yung ano ha, let me add this one. We have a lot of substances that regulates the bone remodeling. Okay, meron tayong parathyroid hormone. Siyempre, released by the parathyroid gland. Where can you see your parathyroid gland? Again, where can you see your parathyroid gland? Sa neck. Sa dapit sa neck. Yung sa osteomalacia, mag-weaken yung bone natin class kasi kulang ng vitamin D, kulang din yung calcium. So mag-weaken yan siya. Madali yan siya masira. Pero hindi lang yan siya sa tuhod ha. Pwede yan siya sa ibang bones pa natin. So kapag example bone sa kamay yung naapektuhan, since kulang ng vitamin D, kulang din yung calcium dyan kasi nga hindi natin na-absorb yung calcium. So mag-weaken, mag-soften yung bones niyan sa part na yan. Madali siyang ma-fracture. Okay? So kaya magpainit-init yun ta. Pero dili pwedeng sobra pod ang painit-init nato. Labi na sa Jensen kay grabe kainit. Atong skin na sad ang maapektuhan nato. So, pero as much as possible, magkakaroon dapat tayo ng interaction or yung exposure sa sunlight. Okay. The parathyroid gland is located sa likod. Sa likod yan siya ng thyroid gland. So, hindi yan sila magkapareho ha. Lahi ang thyroid gland, lahi ang parathyroid gland. The thyroid gland releases our thyroid hormones, the T4 and the T3, which are very important hormones in our metabolism. Okay, metabolism of glucose, metabolism of our fats. Now, si parathyroid gland is located on the back part or the back portion of our thyroid gland. And nagre-release ito ng parathyroid hormones. Now, ano ba yung trabaho ng parathyroid hormone? Ano yan siya? Nag-i-increase yan siya ng calcium sa serum, meaning ini-increase niya class ang absorption and at the same time reabsorption of the calcium. Okay? Kagaya ng ginagawa ng vitamin D. Ay, na-exit ko. Pero ang tandaan nyo, class, ay hindi ako makalagay pala ng arrow, no? But ganito na lang. Increase calcium, pero ang problem with the parathyroid hormone is pinapa-decrease nito ang phosphate. Okay? Yan yung activity ni parathyroid hormone. Okay? So kapag marami ka masyadong calcium in the body class, that will actually give a signal to the brain na, and then your brain to the parathyroid gland to inhibit the release of the parathyroid hormone. Okay? Again, pag marami ka ng masyadong calcium in the body, magkakaroon yan ng feedback in the brain. And then, ang brain mo, magsisend yan siya ng signal doon sa parathyroid gland mo na i-inhibit na, wag na mag-release ng parathyroid hormone para to regulate the calcium kasi nga masyadong marami na. Yun kasi talaga yung trabaho ng parathyroid hormone, mag-increase ng calcium, absorption, and reabsorption. Now, hindi pwedeng marami din tayo masyadong calcium, no? Pag mag-hypercalcemia tayo, pwede tayo magkaroon ng problems with the kidneys. Like, pwede magkaroon ng kidney failure or kidney stones. So, i-inhibit yung pag-produce ng parathyroid hormone para hindi siya magsigi o trabaho sa pag-absorb o pag-reabsorb ng daghang calcium. Kasi nga, marami ka ng calcium in the body. So, yan yung mangyayari. Now, aside from the parathyroid hormone, syempre nasabi ko na kanina, kailangan din natin si vitamin D. Pero si vitamin D is like a pro-hormone kasi siya. Hindi talaga siya totally active when it is just vitamin D. So in the body, after it is being produced, it will be metabolized. And then yung metabolized neto, yung active. Active when it comes to the process of the bone remodeling. At ano ang trabaho ng ating vitamin D? Mag-increase yan siya ng calcium in the serum. So there will be increase in the absorption and the reabsorption of calcium in the body. But when it comes to phosphate, mag-increase din ito ng phosphate absorption or amount in the body. So yan yung difference nila ni parathyroid hormone. Magpapadecrease kasi ng phosphate. Now remember klase, hydroxyapatite. Yan yung tawag sa mineral na talagang nakadeposit sa bones and sa teeth natin. Hydroxyapatite. And then ano yung meron sa hydroxyapatite? Calcium phosphate. Therefore, it's not just about calcium, but we also need the phosphate for our bone mineralization. Okay? And then, meron pa tayong isang substance pero hindi masyadong marami yung information about this one. Fibroblast growth factor 23. If you read your books class, you will encounter these substances. Pero itong si fibroblast growth factor, nire-release ito, napoproduce ito ng both osteoclast and osteoblast. Remember the cells responsible for the production of new bones and yung para sa bone resorption, yung pagkasira ng bones. Doon yan mare-release yung growth factor na ito. Kaya lang, kapag marami kang FGF23, we call this FGF23, yung trabaho naman nito is to decrease phosphate in the serum. So, it may inhibit absorption of phosphate from your diet, or it may increase the excretion of phosphate class sa body mo. So, masyadong marami yung ma-release via the kidneys or sa urine natin if we have a lot of the FGF23. So ito yung mga major na mga hormones and mga substances na nagpa-play sila ng very important role in the bone remodeling. Our body class syempre maintains homeostasis or homeostasis. Kailangan mabalance yan silang lahat para balance yung amount ng calcium, ng phosphate, both in the blood and at the same time sa ating bones. Now, kapag magka-problem ka dyan sa kahit isa lang yan, syempre, masisira yung homeostasis, mawawala yung balance, dun na yung magkakaroon tayo ng kondisyon. So, example, makukulangan ka ng vitamin D, so magkaka-problem ka with the absorption and reabsorption ng calcium mo. Makukulangan yung blood mo ng calcium, wala ka nang magagamit sa mga cellular activities. So yan na yung time na maghahanap na ng panibagong source ng calcium yung body mo. And that's the time na mag-breakdown yung iyong bones. So that will lead to osteoporosis. I hope na intindihan nyo yung connection ng ng calcium, ng phosphate sa pagkabuo ng bones natin. And that kailangan natin siyang i-balance para hindi tayo magkasakit. Okay? Now, before we move on to the drug treatment for our bone disorders, let's have first the non-drug strategies. So since vitamin D and calcium is very important in the process of bone remodeling, so syempre we can have supplements for this. We can take calcium supplements or we can even have, I think we have vitamin D supplements in the market. Okay? Meron tayong mga vitamin D na supplements like cholecalciferol. Active yan siya na vitamin D. That's the other name of the vitamin D, ha. I don't know if you have encountered that one in your community internship or even in your hospital internship. But if you see cholecalciferol, or yung may mga calciferol sa name, cholecalciferol, ergocalciferol, or calcitriol. Ayan, calcitriol or doxer, calciferol, ano yan siya, mga vitamin D analogs and metabolites. Kung hindi man vitamin D talaga yung nakalagay sa label, ha, yung may mga calciferol sa pangalan, cholecalciferol, etc. Vitamin D yan. And we can take that one also para we will have increased calcium in the body, absorption, I mean. Kasi pwede mo naman kasi siyang kainin, no? Marami tayong kinakain na rich in calcium. However, kung wala tayong vitamin D, mahihirapan tayo with the absorption. Okay? Now, if okay lang naman yung absorption process natin, pero kulang tayo ng calcium talaga, we can directly intake calcium supplements, class. Okay? I don't know how to do that. Hindi ako mukha ng chocolate sa gabi. Hindi na ko niya pag nanap yung chocolate mukha na sad. Anyway, yeah, Caltrate Plus and Caltrate Advance. Kaya lang, I'm not really very familiar with the brands. Mas hawod mo sa kuag brands, class. Dili jud ko familiar with the brands. Let us see. Caltrate Plus. That is calcium carbonate, right? Pero what is the plus? The plus there yung the Caltrate Plus also contains vitamin D3. Vitamin D3. Kasi nag-take ka nga ng calcium pero wala kang vitamin D, hindi mo rin yun siya ma-absorb. So kaya sinasabay silang dalawa. Okay? Kung wala kanang exposure to sunlight. So let's take the vitamin D and the calcium ng sabay. Vitamin D3 is what we call the cholecalciferol. So yeah, pwede silang isabay. Pero aside from that, it also have other minerals, no, calcium, the cholecalciferol, that's the vitamin D3. And yeah, we have minerals like copper, magnesium, manganese, and zinc. Those are trace metals, and we need them for the formation of enzymes in the body and other substances. Ang Caltrate Advance, cholecalciferol plus minerals. Caltrate Plus, calcium, vitamin D3, and minerals. Where is the Caltrate Advance? The Caltrate Advance. Hindi ko familiar on brand name. So I don't know ano meron sa kanila. Kung brand lang yung ibibigay niyo. I need the formulation of the Caltrate Advance. It's cholecalciferol plus minerals. So yeah, that's still vitamin D3. And then yung sinasabing minerals dyan, syempre kasama na si calcium. What's the difference with the Advance and the Plus? Maybe it's on the dose. Mas malaki ata yung dose ng Caltrate Advance. Cannot see the formulation. You check the packaging. Tomorrow, I think, holiday tomorrow, no? I don't know if you have your duty, but if ever you have your duty tomorrow, you may check. Kasi both of the Caltrate Plus and the Advance contain the calcium and the vitamin D3 and the other minerals. Pero I'm thinking it's maybe on the dose. Gano'ng karami. Yeah, pwede sabay ang D and ang calcium. The vitamin D3 D3 yung ating parang active, the cholecalciferol. Mild level scoliosis. Actually, I don't know. Wait, let us check. Kasi ever since I read pharmacology books and then yung nilalagay dyan na drugs for bone disorders, I never saw or these books never mentioned scoliosis sa mga ano na ito. Wala ko kitag scoliosis ever since last night I read the Lippincott, this morning I read the cat zoom, wala ko kitag scoliosis. So, pero yeah, that is a good question. Yeah, so let's find out. Scoliosis is a sideways curvature sa spine. Pero most of the time, it's idiopathic. So when you say idiopathic, we really don't know what happened, why your spine is like na-curve. Dami palang reason ng scoliosis. But may mga scoliosis na hereditary, so it runs in the family. There are also scoliosis that is because of the degeneration of the spinal disc, the degeneration of the bones. So kasali pala siya dito, pero hindi talaga siya na-mention ng mga pharmacology books. And at the same time, osteoporosis also is one of the reasons why you may have scoliosis. So, syempre, that's whether to the right or to the left, depende na yan sa condition ninyo, kung paano nag-curve yung inyong spine. Pero when we ask Google about the cure for scoliosis, ang nakabutang dinhi, walang cure for scoliosis except siguro for yung brace na ginagamit na lang nila. Kaya siguro hindi ko siya nakikita sa mga pharmacology books kasi we don't really have drug therapy for that. Pero kung like yung mga naglalagay ng brace, ganon, pwede siguro siyang maagapan. Pero when it comes to drug therapy, wala tayong drugs for that ngayon. Mahirap pala yung scoliosis, no? Kasi na-scoliosis din. Kasali dito yung intake of calcium and the vitamin D. Mahirap pala siyang i-treat kasi number one, it's idiopathic. Meaning, we don't really know the cause why nag-curve yung inyong likod. Yung spinal, ninyo. Okay. Except na lang if the reason is meron kayong osteoporosis, pwede natin ito ibigay. Okay. Calciumate. Calciumate is calcium carbonate. Calciumate. Ayan naman tayo sa brand name. It's another brand, right? The calciumate. Pero I believe that's still calcium carbonate. But I don't know. Yeah, it still contains vitamin D3. Sinasabay talaga kasi yan. Kasi hindi mo yan ma-absorb ang calcium plus kung wala kang vitamin D3. So, tandaan niyo yan siya. Sige kaon og food rich in calcium pero wala kang vitamin D3, wala din tayong mapupuntahan yan. The hectorol is the doxorcalciferol. So, that's another analog of the vitamin D3, yung sa hectorol, Doniza. We need that one for the calcium absorption. Yung vitamin D3, minsan binibigay din yan siya sa someone with problems sa kidneys. Yung may mga kidney failure, renal failure, pwede din yan siyang ibigay doon, especially if the kidney failure has something to do with the calcium in the body. The Calvit Gold, that's another brand. Akong problema ani mga calcium supplements dagko kay sila ng mga capsules murag lisod kay sila itulon. Yeah, that's cholecalciferol. Yeah, so may vitamin D3 and may calcium pa din yan. December 8 or 9. Oske? Oske 8? December 8? Osin. It's my problem with like yung mag-encode na sana ako ng grading nyo. I was scheduled to encode your grade. Actually, I started, pero dili ko makadiritso-diritso kay naglingkod ko sa office, magpapirma ko clearance. Dili mahurot. Tapos, and then we have the OSCE. I really need to find time for the other things. You have scoliosis. So we don't have treatment talaga for scoliosis. But I think yung mga nagbe-brace, pwede pa maagapan pa siya. Ito sa online class. Yung milk is rich in calcium. Okay? So like if you drink milk, that will be a source of calcium for you. Pero you need the help of vitamin D for that to be absorbed, ha. So dapat magkita punta sa sunlight. But yeah, sa Jensen magkita man yun sa sunlight. Naman yun tayo. Interaction with the sunlight. Therefore, we can produce our own vitamin D inside. So that is okay. Okay? So sa mga babae, because remember, risk factor for having osteoporosis yung pagkababae natin. So, kailangan natin ng supplement. Okay? So, let us move on to the pharmacologic therapy. This is very important. We have the following list of drugs. We have here the bisphosphonates. Ito, parang lumabas ata ito sa board exam namin. I just cannot remember, but I can remember my classmates talking about the bisphosphonates na lumabas sa board exam. And then that's the first group of drugs we can give to people with osteoporosis. And then we have the SERMs, the selective estrogen receptor modulators. Calcitonin is one type of a hormone. Let's discuss that later. And then we have the denosumab and the teriparatide. Plus, pag nag-end gani ang drug sa AB, it means it's a monoclonal antibody. Okay? Now, when do we give the drugs? Like, ito may mga non-drug strategies tayo. Yung mga pag-intake ng calcium, vitamin D, mag-exercise, undang sa mga bisyo, and then avoid drugs that can trigger bone destruction. So, yan, naka-enumerate yan siya dyan. Ito, kailan natin sila ititake? Titake natin ito kapag wala din ako napadako, no? Ang ako ang slide. Pero na ako naka-realize yung istorya. Okay? Tinitake ito, class, if someone is diagnosed with osteoporosis, and then at the same time, yung someone with osteoporosis, class, yung edad nila is 50 years and above, both babae man yan or lalaki. Okay, 50 years and above. And then yung may mga osteoporosis tapos nakaka-experience na sila ng fracture. As remember, di ba, they have problems with their bone density, so madaling ma-fracture yung bones nila. Kailangan na talaga nila ng treatment yan. And at the same time, pag tinitingnan yung bone mass or bone density nila, it's very mababa compared to the normal level sa mga adults, young adults. Okay, pwede kasi nilang i-check yung bone density natin. May mga paraan tayo in the medical world to check our bone density. So pag masyado na yung mababa, ayan, magpa-prescribe na talaga yung doctor ng any of this pharmacologic therapy. So let's start with our bisphosphonates. Okay, again, we call them bisphosphonates. So, yung mga names nila, except for the zoledronic acid, nag-i-end ito sa ronate. Okay, alendronate, ebandronate, residronate, and so on. Na yung mga nakalagay sa open and closed parentheses are their brand names. Okay, brand names yan nila. Yung first 5 or first 4 neto, yun yung mga very important and commonly used in the therapy for osteoporosis. The first 4, alendronate hanggang zoledronic acid. Okay? Now, ano yung mechanism of action ng ating mga bisphosphonates? Paano sila nakakatulong sa someone with osteoporosis? As you can see, there is a decrease in the osteoclastic bone resorption. And paano? Because of it actually increases the osteoclastic apoptosis. What do you mean by apoptosis nga? Parang I can remember, parati ko tong ginagamit na term. Like, ang pinaka ginagamit ko talaga ito na term na apoptosis kapag ka nagdi-discuss ako ng monosodium glutamate. So, feeling ko first year pa lang kayo na mention ko na ito sa inyo, especially sa Pharm in Org. Okay? What do you mean by apoptosis? It's, yeah, that is correct. Programmed cell death. Okay? Programmed cell death. So, ano mangyayari? If we are going to take bisphosphonates class, it will trigger the death of the osteoclasts. So, remember, osteoclasts are cells in our body or in our bones that is responsible. Anong trabaho nito? Mag-break down ng bones natin. Kasi 'di ba sa remodeling process, mag-break down yung ibang bones, tapos mag-synthesize na naman tayo ng bago. So yung pag-breakdown ng bones, pagkasira ng ating bones, ng responsible niyan si osteoclast. So pag nagbigay tayo ng bisphosphonates, namamatay yung mga osteoclast natin. So pag walang osteoclast, pag bumaba yung number ng osteoclast natin, syempre nagsuslow down din yung pagkasira, yung bone resorption na tinatawag. Okay? So, aside from that, bisphosphonates can also inhibit the cholesterol pathway, which is also very important in the osteoclast function. So, number 1, bisphosphonates can slow down the activity of the osteoclast. Papakialaman niya yung cholesterol biosynthetic pathway that is important in the function of that cell. And at the same time, talagang papatayin. Okay? Papatayin yung osteoclast. Yan yung gamit ng ating mga bisphosphonates. Okay? Now, for the pharmacokinetic profile of these drugs, this is true for all our bisphosphonates. They are given orally. Our problem is they are poorly absorbed in the gastrointestinal tract. Okay? So actually, 1% lang ng iniinom na bisphosphonate yung naa-absorb. Okay? And at the same time, kapag sinabayin mo siya sa pagkain and sa other drugs, most of the time, at least 100%, yung mga sinasabay natin na food and mga drugs will interfere in the absorption of the bisphosphonates. So this is a board exam question. Again, this is a board exam question kung paano daw natin dapat i-take yung yung mga bisphosphonates. Take note of this. Should be taken in the morning, with an empty stomach. Okay? Please take note of the empty stomach kasi nga hindi natin siya pwedeng isabay sa pagkain or sa ibang drugs. And at the same time, kailangan mo din uminom ng maraming tubig with at least 240 ml of water. So take note in your farm calculations. PharmCal, when you say 240 ml, that is equivalent to 1 glass full, okay, of water. Okay, why do we need to intake a lot of water? Because we take this orally, but we eliminate the bisphosphonates in the kidneys. So we need something to aid in the excretion, and that is water. Okay, but we need to we should not be giving these drugs to patients with severe renal impairment kasi they cannot eliminate this drug because of their problems sa kanila kidneys. Okay, questions so far about our bisphosphonates? Wala? Sure. Okay. So how about the adverse effects? This can cause gastrointestinal tract na mga adverse effects like diarrhea and abdominal pain, and at the same time musculoskeletal pain. Okay? So yung mga adverse effects ng ating drugs class, most of that will be just in extension of their pharmacologic activity. Yung iba dyan because of their interaction to the other receptors in the body. So like this bisphosphonates, their target is the osteoclast. But when you have this in your blood, they may also interact with the other receptors, and that will explain their adverse effects class. Okay? Now, alendronate, risidronate, and the ibandronate are notorious of causing esophagitis and at the same time esophageal ulcers. So this is another board exam question. Aside from the way we take this drug na in the morning with empty stomach and at the same time a lot of water, at least 240 ml water, take note that the patient should remain upright also after administration. Kailangan nakatayo or just nakaupo, basta upright pa rin yung position ng body. Para the drug will really flow efficiently, move efficiently in the gastrointestinal tract, it will not remain in the esophagus kasi nag-cause sila, especially itong tatlo, ng inflammation of the esophagus, and pag hindi naagapan, it may lead into ulcer. So, kailangan upright. Ha? Tandaan nyo yan siya. Especially if nagdi-dispense kayo neto sa community or sa hospital, you really have to inform your patients on the methods of taking these drugs. Okay? And then etidronate can cause osteomalacia if we take this on a long-term basis or pag merong mga continuous administration. So, instead na it will be a treatment for osteoporosis, it will be causing osteomalacia, magsusoften or weaken yung bones ng ating patient pag prolonged treatment with the etidronate. So kaya ito yung reason na the first four are the ones that are really used in the therapy. Okay, questions on the class? Bisphosphonates before we'll move on to another group of drugs. Wala, it's already 8:30. Okay, let's talk about the SERM. Serotonin, selective estrogen receptor modulators. Take note of this class, we have, if low yung estrogen natin, again, pag mababa kasi yung estrogen, there will be proliferation and activation of our osteoclast. So that means bibilis yung process of our bone resorption. Very active yung mga osteoclast kapag kulang ng estrogen. Si estrogen kasi pwede siyang mag-regulate class ng ating bone remodeling. So mga babae, we're really affected of this. Pero actually yung mga lalaki may estrogen din naman yan sila sa body nila. So kapag hindi din normal levels yung estrogen sa body nila, that will also affect them and that may also lead to bone loss. So especially sa mga babae if postmenopausal na, syempre nag-iiba na yung amount ng hormones after the menopause. So, kaya babae talaga mostly naapektuhan nito, matatanda na mga babae. Okay? So, there will be a lot of bone loss after menopause na, kaya kapag ka nag-menopause talagang kailangan ng like calcium supplement, then syempre the vitamin D3 para ma-absorb talaga siya. Okay? However, kasi kapag marami ka din namang estrogen sa body, there will be an increased risk for you of having cancer, especially endometrial cancer, or breast cancer. Yun lang yung problem natin with maraming estrogen. Kaya, di ba sabi ko, yung mga matatandang dalaga pag hindi nag-asawa, and at the same time, yung if for example, isa lang yung anak mo, you may be prone to having breast cancer or even endometrial cancer kasi masyadong marami yung estrogen in the body. Hindi kasi na-disrupt yung ating estrogen cycle pag hindi tayo nabubuntis. So imagine pag nabuntis tayo, the whole duration or the time na buntis yung isang babae class, na parang hindi nagre-release ng maraming estrogen yung body. So distracted yung cycle ng estrogen. Whereas i-compare mo doon sa person na hindi talaga nanganak, hindi nabuntis, hindi talaga na-disrupt yung cycle ng estrogen. So marami silang estrogen sa body. Kaya prone yan sa breast cancer. Don't know if you have observed that one. Yung mostly na nagbe-breast cancer yung mga walang asawa o kaya merong isang anak. Mostly hindi naman lahat, pero yung most of the cases. Okay? However, breast cancer is the most yung pinakamadaling i-treat na type of cancer. Marami tayong survivor for the breast cancer. D3 lang. The vitamin D3, the cholecalciferol. Yan kasi yung active na vitamin D3. Okay lang naman yan yung sa mga elderly. May siguro they can get the calcium in their diet. Siguro umiinom din sila ng gatas, especially yung gatas para sa adult na maraming calcium. So kaya kailangan na lang nila ng vitamin D3. So okay lang din naman. Okay? Yung estrogen pag sinabay natin with the progestin hormone, especially if intact pa yung uterus, mag-a-at risk to endometrial cancer yung babae. At the same time, pag marami tayo masyadong estrogen sa body, we may have a high risk for the venous thromboembolism. Remember, this is blood clot, formation of blood clot. So estrogen also has something to do in the formation of our blood clot and yung mga cardiovascular functions natin, mga babae. So we have to balance this one also. Kasi pag masyadong marami, cancer yun and other cardiovascular conditions. Pero pag masyado namang konti yung ating estrogen, magkaka-problem din tayo with our bones. So meron tayong drug. We have here the tamoxifen. The tamoxifen is actually the first selective estrogen receptor modulator na talagang natapos yung study hanggang post-market surveillance and na-release talaga sa market. Okay? Pero hindi ito yung talagang ginagamit for osteoporosis. Kasi si tamoxifen is given for women na merong breast cancer. Especially yung isang breast niya nagkaroon ng cancer, to prevent the other breast to have cancer also, binibigyan yan siya ng tamoxifen. Kasi si tamoxifen will block the activity of estrogen in its receptor, especially in the breast tissue. Kaya nga siya tinawag na selective estrogen receptor modulator. Okay? Now, ang para sa osteoporosis na SERM class is the raloxifene. So, brand name niya ito. Itong Evista. So, ganun pa rin. Parehas lang naman sila ni tamoxifen na mag-i-interact sila on the estrogen receptor, preventing ano siya, modulator siya, so baliktad pala siya. This is approved para sa treatment ng osteoporosis. So baliktad yung kanyang action, modulator siya sa baliktad na activity. Hindi siya doon sa estrogen talaga na para sa breast cancer, but its activity is on the ang tawag dyan, bone resorption. Mag-i-inhibit siya ng bone resorption pero hindi siya mag-stimulate ng breast tissues. Okay? So ginagawa itong raloxifene, ginagawa itong alternative ng bisphosphonate kapag hindi kaya ng person or ng patient yung effects ng bisphosphonates. Remember, nagko-cause siya ng gastrointestinal tract na adverse effects yung bisphosphonates and then yung kapag yung tawag dyan, yung sa esophagus and so on. Pag hindi na kaya yun ng patient, ayun na yung ginagamit natin, si raloxifene. So meron siyang estrogen-like activity on the bones, pero antagonist siya on the breast tissues. Okay? Doon sa bones, si raloxifene para siyang estrogen. Remember, kailangan natin si estrogen para hindi mabilis yung pagkasira ng bones. Okay? So kapag nag-inom tayo nito doon sa bones, para siyang estrogen. I-inhibit niya yung trabaho ni osteoclast. Okay? Pero doon sa breast tissues, magiging selective, kaya siya tinawag na selective. Kasi sa estrogen receptor sa breast, magiging antagonist siya para walang breast cancer. Okay? Now, adverse effects of our SERM, syempre, since it has something to do with the hormones, pwede siyang mag-cause ng hot flashes, ng leg cramps, and at the same time, since this will also act just like estrogen, this may cause thromboembolism. So it may trigger also the formation of blood clots. Okay? So, ganun yun ha. Tamoxifen, hindi ito ginagamit for osteoporosis. Yung kanyang selectivity is on the breast tissues. Magiging antagonist siya doon para hindi si estrogen bind sa kanyang receptor, because estrogen can cause breast cancer class sa mga babae. So this is an anti-cancer drug, si tamoxifen. Pero si raloxifene in the bones, selective siya as para siyang mag-act as an estrogen. So parang agonist siya on the bones to prevent bone resorption or yung pagkasira ng bones natin. Pero at the same time, kung sa breast siya, selective siya sa breast tissues as an antagonist. Okay? And then we also have calcitonin. The brand name is Fortical. This is also indicated sa treatment of osteoporosis sa women, especially if yung 5 years na nag-menopause. Okay? Walang question, no? Wala. Ayan. And then this also relieves pain associated with osteoporotic fracture. So paano ba nagtitake ng action si calcitonin? Calcitonin is actually a hormone na released in the body. Pero meron din tayo nitong parang preparation na binibenta sa market. So nagre-reduce ito ng bone resorption, the same activity with that of the bisphosphonates, but yung action lang ni calcitonin is inferior. So hindi siya ganun ka-effective when it comes to promoting the deposition of calcium in our bones. Okay? Now, Paano ina-administer yung prepared natin na calcitonin? It can be intranasal or parenteral. So, kaya kasali sa adverse effect niya yung rhinitis kasi nga intranasal siya binibigay. And at the same time, it may cause risk of malignancies. So, hindi siya masyadong ginagamit for treatment aside sa inferior yung kanyang activity kay bisphosphonates, nagkukos pa siya ng malignancy. Sa body kasi, nagre-release tayo ng calcitonin, yung activity nito sa body, naglo-lower siya ng calcium sa blood natin. Yung calcium, dinadala niya doon sa bones para maka-help in the mineralization ng bones natin. Yan yung trabaho ni calcitonin. And then we have the denosumab, the brand name is Prolia. Sabi ko kanina, pag ang drug nag-end sa AB, it is a monoclonal antibody. So it's an antibody that is produced through DNA recombinant technology. So paano ba nag-work si denosumab? This targets receptor activator of nuclear factor kappa B ligand, which is class an important factor in the activity and proliferation of our osteoclasts. So the same thing. Remember, ulitin ko, osteoclast yung cells responsible sa pag-destroy ng ating bones. So itong monoclonal antibody na ito is produced against the factors na involved doon sa function, sa activity, and even the proliferation pag-produce natin ng osteoclast. Okay? So kanino ito binibigay? Binibigay ito sa mga postmenopausal women with osteoporosis. And at the same time, they have high risk of fracture. Kasi ito yung problem natin with having osteoporosis. Weaken yung kanilang bones, so madaling ma-fracture. So minsan namamatay talaga sila class kapag na-fracture, especially their hip bones. Example, na-fall sila and then nabali yung hip bones nila, pwede kasi silang mamatay nito. So kaya to inhibit class the osteoclastic activity, pwede siyang ibigay. How do we give this? Via subcutaneous injection every 6 months. Okay? However, since this is a monoclonal antibody, it can weaken the activity also of our immune system. That is why kasali sa adverse effect nito yung increased risk of infection. And since this is given subcutaneously, pwedeng merong mga dermatological reactions. Now, it can also cause hypocalcemia, kukonti class yung calcium sa blood. So, ma-inhibit yung osteoclast na activity, calcium will stay in the bones. So, kapag tumatanda tayo, lumiliit yung calcium natin sa ating blood. Magha-hypocalcemia, hindi kasi kung sa osteoporosis, hindi magbe-breakdown yung bones. So, wala tayong source sa calcium kung hindi sa dietary ha. Walang breaking down of bones, so kukonti class yung calcium sa blood. And osteonecrosis, especially sa jaw, pwede siyang mag-trigger sa pagkamatay ng bones there on the jaw natin. Because this is an antibody that will target one type of cell in our bones. I think this is the last one before we'll end. The Peripharatide. Ito silang dalawa, actually lahat ito sila except for the calcium na vitamin D3 are not really common drugs. We have here the Peripharatide, the brand name is Fortio. This is a recombinant form of our parathyroid hormone. So again, na-mention ko si PTH kanina, si parathyroid hormone na nire-release ng parathyroid gland. Diba ang trabaho ni parathyroid hormone to increase the calcium and then pero ibababa niya si phosphate. Now, how this is given? Recombinant na form, yung ginaya, yung sariling parathyroid natin. Tapos naging drug na siya. Inibigay ito subcutaneously daily ha, unlike the denosumab na every 6 months lang. Ito daily for osteoporosis. Mura siyang insulin class adlaw-adlaw mag-inject subcutaneously. Pero syempre, insulin is used there sa diabetes mellitus. This one is for the osteoporosis. So this is the first drug na na-approve natin na nagsustimulate ng bone formation. So baliktad ito, most of the drugs class na na-mention natin, the target is the osteoclast. I-inhibit ang activity ni osteoclast para hindi mag-breakdown yung bones. This time, ito yung first drug natin na mag-stimulate ng activity ng osteoblast. So, di ba sabi ko, si osteoblast is the type of cell in the bones na responsible in the formation of new bones. Okay? Ang problem lang natin with the teriparatide, yung animal testings nito showed na nagkukos siya ng osteosarcoma in rats. Ano ba yung osteosarcoma? Di ba nag-mention tayo ng different types of cancer last time sa laboratory. So sarcoma is a type of cancer sa mga connective tissues natin. This time, it's on the bones. So hindi pa na-evaluate yung safety and efficacy ng teriparatide talaga beyond 2 years. So medyo limited pa yung gamit natin nito. Kasi very effective siya in the synthesis of new bones. Pero siguro because of the too much activity, bibilis syempre yung mga cell divisions and so on, yung formation ng bones. Kaya minsan nauuwi siya sa cancer. Kasi di ba yung problem natin sa cancer, masyadong mabilis yung cell division. Kaya nagkakaroon ng formation of a tumor or a lump. Okay? So, yan yung problem with the teriparatide. So, that's all for our drugs for bone diseases. Okay? Questions? That is starting from the bisphosphonates. Pero kung sa osteoporosis talaga, what we are using is the bisphosphonates. Meron lang siya mga adverse effects. Kaya minsan hindi siya natotolerate ng ating mga patients. Questions or clarifications before tayo mag-end?